Hi, I'm Dr. NGYN and I have a clinic in Portland, Oregon. I'm going to talk about the Gshot. The Gshot is a procedure that we do in the office to enhance the sensitivity of the Gspot. The Gspot is the Grafenberg spot that is a little controversial. Some people don't believe it exists, but there are definitely women that do believe it exists. It is located under the urethra in the vagina, and it is a neurovascular bundle that is very sensitive to the touch if it is an area or an erogenous zone for women. That many women know where it is, some women don't know where their G-spot is. The G-shot is intended to enhance the sensitivity of the G-spot. What I do in the office, if a woman says the vaginal sensitivity is something that is part of my sexual experience and I want to enhance that sensitivity, it is not for patients that this is not an erogenous zone and they want to create a new erogenous zone, or it is not for patients with sexual dysfunction where we're trying to fix something that's broken. But for women that have a spot that is sensitive, that they want to enhance that sensitivity, we do an office procedure after a consultation. The cost of the procedure is $8.99. What I do is I use a filler called hyaluronic acid, and it is injected transvaginally. Doesn't take very long. What I do is I place a speculum in the vagina. It is a patented speculum that has a channel down the middle where I can carry out the injection. The patient first identifies her local sensitivity area, and we actually do measurements to find out exactly where the location is and mark the area on the speculum. The speculum is placed in the vagina, and once the area is marked, I take a long spinal needle and inject local anesthesia so that the patient won't feel the filler going in. Patients actually tolerate the local anesthetic very well because this portion of the vagina, the skin itself, is not very sensitive. It's actually that neurovascular bundle under the skin that's very sensitive. So I inject local anesthetic just as a dentist would when they're going to do dental work. And then I bring the needle out. There's 3 cc's of fluid for this filler that I put in. I pass the needle through the patented line in the speculum. I raise the spot so when the filler is fully in place, it's like a pitcher's mound that's gotten bigger. So women can then sexually, in certain positions, find that G-spot more readily and have more vaginal arousal, or their partner can find it easier because it's a bigger bump. Thus the G-shot, it lasts about 4 to 6 months, and then the hyaluronic acid is absorbed in the body, but some patients have described that the sensation or the enhanced sensation lasts longer than that. My belief is that there's a certain amount of learning that required for both partner and patient to know where it is, and once they've found it, they don't need to have repeated injections. So that's the G-shot.